Did we get that right? Hello, my friends. I want to make sure I get this right. Yeah. Yes. Hello, 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 my friends. Jill Osborne here from the Interstitial Cystitis Network. It is September 1st. And you know what that means? It is the start of IC Awareness Month. So I thought I would go ahead and just do a drop-in meeting. Let's see if anybody needs help today. If not, that's okay. I'm good. But we want to take a moment and really recognize the 1 month of the year that IC patients get together to share their stories. IC Awareness Month is the most exciting part of the year for the IC community because it is when we gather together, man. We're ready to kick some butt. We're ready to push back at anybody who who believes that IC isn't real. We are ready to advocate for patients in need, such as students. I had a request from somebody who who was it? It was a survey from a high school student, and they had decided that the students were only going to be allowed 4 restroom passes a year. And she had done this big survey and asked for people to support her. Not only did I do the survey, I actually sent a letter to the superintendent of schools of her district to point out the error of their ways and how unfair this would be for IC. Hello, Tabitha. Hi, Angie. Hi, Carol. Nice to see you. Really, really nice to see you. I'm like totally into IC Awareness Month right now. It's very hard to kind of get myself there because it's been such a busy year. But on the other hand, you know what? It is a fun, exciting time. So let's see here. I want to make sure that this is good for Facebook. Bear with me. All right. All right. Is that good for Facebook? All right, because we are simulcasting live on YouTube. Hello, whoever it is on YouTube watching. Nice to see you. If you got interstitial cystitis, you're in the right place. This is a drop-in meeting, but we're also simulcasting on Facebook. And so on Facebook, we have a nice little crowd coming in. Hi, Linda. Hi, Krishanda. Hello, Jessica. Oh, you guys. So, guess what? IC 101, the book is finally on Amazon. Took me 2 freaking weeks. So for anybody who wants to learn about IC today, this is our course, IC 101. That's why it's called that, because it's kind of a course on IC. But the subtitle is it's not just a bladder disease. And that's because we now know that for many patients, the bladder is a victim of something else that's happening in their pelvis, right? So we have to understand that. So let me just take a moment, and I'm happy to take your questions. This is a regular support group meeting. If anybody has any questions out there that you need some help with, and if you're discouraged, if you're frustrated, and you just have some questions, please give them to me, man. I'm ready to take them. But I wanted to start off this meeting with what you can do because of IC Awareness Month. So there you go. There's our poster. ICAwareness.org is where you can go and learn a lot more about what we're trying to do this year. But there are several things that you can do that I hope you will do. The first thing I'd love for you to do is download our press release. Our press release is all about COVID cystitis. Now we got to be real here. I mean, the whole reason why we switched IC Awareness from October to September is because we couldn't compete with the breast cancer awareness stuff, right? September was a clear month, and we've done very well with our outreach over the years in September. But now in the era of COVID, it's quite challenging. It's quite challenging. And so what I decided to do for our press release this year that I thought might give us a little bit of oomph in the media, if for media who might want to do a story about this, is we're going to talk about COVID-associated cystitis. We do know, for example, that many IC patients who develop COVID report sudden extreme flares in their symptoms. I was working with one earlier today, and she is a wreck. She's had Her bladder has been off the charts ever since she got COVID, like 10 months ago. We now know why that's happening. That's because of the cytokine storm. It's a very strong, severe inflammatory reaction that sometimes happens. It's our body doing it, and it's releasing a lot of inflammatory mediators into the skin, into the bladder wall, into the urine, throughout the body, in your lungs. And that's what is ending up, that's what's causing people to be in the hospital. That's what's causing so much damage to the lungs. Well, not surprisingly, they're finding that same cytokine storm in the urinary tract. They're finding it in the kidneys, and they're finding it in the bladder. Generally, these are people with moderate to severe COVID. And it's only in the severest COVID patients where we actually also find live virus in the bladder. So again, we really pretty much believe that it is an inflammatory response in the bladder. So in our press release, I linked to 9 studies. It's a great educational tool. If you have anybody who's telling you that it's not real, that will certainly prove that it's real. Like the woman I was working with today, whose doctor just said it was all in her head. It certainly is not all in her head. It's quite a dire circumstance. And actually in these cases, really good pain control really is a must at this point in time. And so hopefully the information in that press release, along with the supplementary studies, will help build a case for you as you seek more care and as you seek pain care. Now, the other reality with COVID is we have a lot of people who've never had bladder symptoms who all of a sudden, because of COVID, they now have severe urinary tract symptoms, very similar to IC, frequency, urgency, pressure, pain. And this is where we have something to give back because we can help them. You can help them. Number 1, you can tell them that it's not their fault. Number 2, you can tell them that it's real, and we have the data to support that. But then, we've got a really good set of self-help skills in this wonderful IC community, from diet to relaxation to whatever. We have resources and comfort and support that we can give those patients who are now struggling with COVID cystitis. And I hope that you will use this as an opportunity to do that if you encounter anybody in your circle who are struggling with newly onset cystitis symptoms. Now, with respect to therapies, we don't have good data on how to treat it yet. And as soon as we get that, I will let you know. So again, the first thing you can do is go to our website, go to our media kit, and download our press kit. The second thing that you can do is use our daily fact. Every day there's a new fact on IC that you can share on Instagram, on Facebook, on Twitter. And again, it's just about educating people. It's about educating people that this happens to children. It's about educating people about the fact that intimacy might be a little bit uncomfortable. It's about educating people about Hunner's lesions and what they look like, and about flares, and about diet, and all that sort of stuff. So every day there's a new daily fact. You can get it on our website that you can share across your social media. All right, where did my list go? Here we go. The third thing that you can do that I hope you'll do is participate in our poster contest. Our poster contest, every year we've done a poster contest. This is our early winner from the very first year. This is amazing, the patient who did this. $100 gift certificate from Amazon for the first place, $50 gift certificate, second place, $25 gift certificate, third place. You can do it. You can have family members do it. If you have a child who wants to do it, you know what? Put that crayon to paper, take a picture of it, send it to us. And we would love to put that in our poster contest. We just really want to give you as many opportunities as we can to have a little bit of fun. Be creative. Just listen. If you're up in the middle of the night, you can't sleep. All right, go get a piece of paper, get some crayons, markers, even pen and paper. And let your pain out on paper. Show us what it's like. Tell us your story. Tell us your story about what life is like with IC. And we would just love to have you in there. And I'd love to be able to give you the $100 or any one of those Amazon gift cards. And then if snarky is your way to go and you like humor, then we also have a meme contest. And I'll be posting some of the memes from last year, but they're hysterical. I mean, they're so funny, So again, all those memes, for those of you who've been around for a long time, you know what I'm talking about. You can find those right on our icawareness.org website. And I will be putting them through all social networking on Twitter, on Facebook, and et cetera, and Instagram too. The next thing, where's my list? The next thing that you can do is we do have for Facebook and Instagram users, we do have artwork that you can do. We have a turquoise ribbon that you can put on your profile, and we also have a header that you can put on your profile for IC Awareness Month for the 30 days of September. Or really, I mean, like seriously, like I'm long past the days of thinking that people, that people should stick to the formal stuff. You know what? Let it fly. If you want to create a timeline, a header, if you want to create your own little Facebook profile image in honor of IC Awareness Month, do it. Do it. Let's just, again, no shame, no blame. Let's just unite. There is power in numbers. The more we work together, the better we're going to find those patients who are suffering in silence. I mean, that's the entire purpose of this, right? Now, some people say, hey, I'd like to make a donation. I want you to know that I have never accepted donations for IC Awareness Month. IC Awareness Month is not about the IC Network. It's not about the ICA. It's about you. It's about you. I'm a rebel. I've always been a rebel. I never believed in sending money to national groups. I think money that you raise should be used in your state. It should be used for something that you believe is appropriate. And of course, the most important thing is research. So again, on our website, icawareness.org, I have the information on how you can make a donation to the top IC research center in the country, Beaumont Health. I think that they're fabulous. And if you want to spend them $25, $50, have a garage sale, bake sale, whatever, go for it. And then last but not least, it would be really awesome if you would consider donating a book to your local library. It's important. There are a lot of people out there who are very low income. They don't have access to the internet, or they're visually impaired. They can't use the internet, and they would prefer a book. They would prefer something hands-on. We have got to get more books on IC and pelvic pain in local libraries. And if you could do that, that would be incredible. So the book, of course, that we're recommending this year is, of course, our new book, IC 101. It's Not Just a Bladder Disease. And if you wanted to call me and do it, I'll give you a huge discount on it, right? I mean, like a lot of money off if you'd like to make a donation and have me send it to your local library. All righty. So those are just some of the ways that you can participate in IC Awareness Month. And I hope you'll join us, and I hope you'll do it. I mean, it's just like, if not you, who? Who's going to do it? It's not like there's some sort of magical organization that's going to step in and devote millions of dollars to educating doctors and community members about IC. Not real, not going to happen. And there's really no pharmaceutical company at this point in time who's going to be involved anymore. And so it's up. It's a grassroots movement. We gotta do it on our own. And you know what? That's okay. We're good. We can tell our stories. Angie says, hi, I had a kidney stone a few months back and have a lot more trouble with my IC. Is that normal? So, Angie, the problem with stones is that they're very, very sharp and they're covered with bacteria. And so as that kidney stone is coming down your ureter and coming into your bladder and floating in urine, it is basically scraping and cutting the tissue around it potentially, and also potentially introducing bacteria into the scrapes. Again, stones are just covered with a huge population of very diverse bacteria. It's not just one bacteria, it's lots of different types of bacteria. So, bladder healing takes a little bit of time. But the question is, it's now been months and months later. 2-3 months later, I would have assumed that any of the residual damage that stone might have done would have healed by now. So I guess is there anything else that could be triggering your flare, Angie? So for example, sometimes what they do for patients with kidney stones is they put you on a very high acid diet. They've got you doing a lot of vitamin C, drinking lemonade, stuff like that. That could certainly irritate your bladder. Now you say you seem to have a sore spot. This is important, you guys. This is really, really important, because if your pain always comes back to a specific location, we have to understand that location a little bit more. Number one, is it centered? So, you know, again, you get to see my belly, my COVID cinnamon roll belly. So I always ask patients, where is your pain located? Is it directly in a line straight down? So your bladder is like right over your pubic bone right here. Or is your pain to the left or to the right of center? So as an example, I have a little sharp pain that I get if I sit too long that's about an inch to the left of my rectum or an inch and a half to the left of my rectum. It's like it's on the inside of my my hip, bone in there. And it is a nerve that I have compressed because I just don't have a lot of fat on my butt anymore. And you know, this is where having a nice big tushy is good because it provides a lot of cushioning, protection for the wounds that are in the pelvis and in your butt. And unfortunately, I lost a lot of weight several years ago and ended up sitting directly on bone and nerve and ended up irritating that nerve. So I have a slight pudendal neuralgia, again, about an inch, inch and a half to the left of my rectum. So anytime you have a specific location, we always want to get your doctor's assessment of that location. You know, and your question is always going to be, what's there? What's located there? We have to understand what's located at that location. And so focus them on that. All right, let's go here. Jessica says, thanks for my free magazine. You're very, very welcome. Thank you, Jackie. Lori, is there any research on IC? Oh, girl, I want you to Google MAP Research Network, MAPP. So the PP stands for pelvic pain. MAPP Network. They are the largest IC research team in the United States. They're funded by the National Institutes of Health. They have done massive research into IC. There's IC research literally every week that comes out that's very, very exciting. And so lots of really good research is happening with IC and pelvic pain. And Lori, I've talked about this before. So the MAP research was set up to take a multidisciplinary approach, a multidisciplinary look at IC. So in other words, instead of just using urologists, they've got gynecologists, they've got lots of different medical specialties because we're trying to get a whole body look at the mechanisms behind pelvic pain and IC, et cetera, et cetera. So they've got neurologists, they've got physiatrists, they got orthopedic surgeons, they got pathologists, you name it, they've got it. It's really a dynamic research team and network. And they were the ones, along with the Chronic Pain Research Alliance, who about 10 years ago started doing brain scans. It's like, is our brain different? Is the brain of somebody with chronic overlapping pain conditions like IC and IBS and or patients with IC, is our brain different than others? And the answer is, in some cases it is. In some cases it is. And I've talked about that before. This IC subtype 5, central sensitization, chronic overlapping pain conditions, is in fact a central nervous system sensitivity. And what those brain scans have told us is for patients who have multiple pain conditions, the brains are stuck in fight or flight. We have a tremendous amount of anxiety because our brain on any given time, at any given day, thinks our life is at stake. That's not a mental illness. It's what we call a central nervous system maladaptation. It means that the nerves have been trained incorrectly or they have adapted incorrectly. And so that research is remarkably exciting because now we understand why some of us have extreme anxiety. This is in my group. Okay, I'm in this subtype. No shame. I'm in it. Good. I have IC. I had IC, IBS, vulvodynia, TMJ, migraines, fibromyalgia. If you've got 2 or more related pain conditions, you have a new diagnosis, chronic overlapping pain conditions. And what's so exciting about this research is we know how to fix it now. We have to get the brain out of fight or flight. And we do that not with bladder therapies or pelvic floor physical therapy. We do that with for lack of a better term, brain physical therapy, also known as mind-body medicine mindfulness. And once we can turn that off, everything calms down, pain reduces, and really good things happen. So that's a really good example, Lori, of some of the super exciting new research that's been going on. Now, of course, we also have the American Urology Association meeting this month in September. It has been canceled in person. It was supposed to be in Las Vegas, but they are going to be doing it virtually. I will be there. And that's where all the new research studies are presented. And so in our fall magazine, I will be doing a lot of discussion about all the new research that they are doing. And so carry hope in your heart. The research is awesome. I'm so excited. Cassandra said, is pelvic congestion syndrome mistaken for IC? And the answer is yes, frequently. It is frequently mistaken because, number one, these patients can have frequency urgency pain, but it's a symptom of pressure and heaviness that really distinguishes between a typical bladder wall issue as compared to a circulatory system syndrome. So pelvic congestion syndrome is the equivalent of varicose veins in your pelvis, really large veins that end up collecting a lot of blood. And the classic symptom of somebody with pelvic congestion syndrome is, as you're going throughout your day, if you feel like you're carrying a weight, and it gets heavier and heavier and heavier as the day goes on. And so by the end of the day, if you got pelvic congestion syndrome, you're carrying a freaking bowling ball around in your pelvis. And we have, again, I've been a support group leader for 28 plus years. That is one of the early common symptoms, and we didn't ever understood it. We didn't understand why some patients had this heavy, heavy, heavy weight at the end of the day. Now we know that that's pelvic congestion syndrome, and it's extremely treatable. You go to an interventional radiologist who will make the diagnosis, and then what they do is they treat the vein just like they treat varicose veins on your legs. And when you treat the vein, it goes away and things get better. So pelvic congestion syndrome is a good example of a condition that many patients have had a misdiagnosis of. So again, if you're carrying that bowling ball around in your pelvis at the end of the day, we always want to look at pelvic congestion syndrome as a possible cause for that. Jessica says she wants IC 101. IC 101, you can get on our website for $9.99 as a PDF file. You can get it in print on our website for $24.99. and or on Amazon for $24.99. Okay. And it is a big, heavy book. It is spiral bound. It's spiral bound because we want you to be able to open it up and make notes. It's on paper. You can write on it. For God's sake, I hope you mark it up. I hope you highlight it. This is the first of a whole new series of books. We will have the IC 101 Flare Management Guide, IC 101 Diet Guide. The Diet Guide's almost done right now. Hi, Ellen. Jessica, is there any tea that is non-acidic or low acid that you suggest? Yeah, chamomile herbal tea, peppermint herbal tea, or any rooibos herbal teas. But you got to be careful with the rooibos. Look at the other ingredients in there. Make sure they haven't put any citrus or anything like that in there. On our website, we sell a pumpkin spice rooibos tea, which is to die for good. It's sold out right now across the country. We haven't been able to get it for a couple months, but it's not particularly pumpkin-y at all. It's more like a caramelly, and again, zero acid, very, very well tolerated in most IC patients. Hello, Bernadine from Western Kentucky. Jessica says, I've already tried Pre-Leaf and it didn't seem to help. Okay, now you guys, you got to have a reality check about Pre-Leaf. Pre-Leaf is an awesome supplement. It's the oldest supplement. It is calcium glycerophosphate. It is designed to reduce acid in urine so that your bladder doesn't get poked and prodded by the acid. So if you're going to have a cup of coffee, even though you know you shouldn't, but you're going to do it anyway, or some wine or some soda, 1 or 2 Pre-Leaf while you're doing that will dramatically reduce the acid load, and you might be able to tolerate that more and not have a flare. And this is especially true now that we are in the holidays are coming up. My God, you guys, it's September 1st. I mean, like, the holidays are coming. And of course, COVID is messing everything up again this year. I hope we get trick-or-treaters this year. I really do. But Pre-Leaf is an absolute essential if you were to go to grandma's house and she was serving her famous lasagna, which happened to be really, really acidic, that's given you terrible flares in the past, but you didn't want to hurt her feelings, this is when you take pre-leaf, 1 or 2 caps before, and that would be reasonable. But you have to remember that pre-leaf is not a pain reducer. It's not a treatment for your bladder. It's not like your bladder is going to miraculously feel better when you take pre-leaf. That's not the way it's designed to do. Okay. Hi, Marion. What the hell? Marion says, I'm on my 5th antibiotic for IC now, and you're having pain underneath your right rib cage, and it's bad. I also have long COVID. Well, if you have an active bacterial infection, you are excluded from a diagnosis of IC or bladder pain syndrome. So what kind of infection do you have, hon? Are you struggling with like a really drug-resistant infection, like a E. coli? Jessica said, I was told that antibiotics don't help because it is IC. I was told this by urologists. Everyone is different, though. Jill would know. Oh, God. Oh, that scared me. Oh, that was a wind gust. Antibiotics are not a therapy for IC. But again, IC doesn't mean anything anymore. It's a grab bag diagnosis, right? And so it's all about your subtype. So IC subtype 1, Hunner's lesions, which could be viral in nature, antibiotics, waste of time. IC subtype 2, bladder wall driven, chemical injury like chemo or drinking too much soda, antibiotics, waste of time. If you have estrogen atrophy and you are getting recurring infections, antibiotics would potentially be helpful, although we don't want to take them for a long period of time. And there are some patients who might have chronic infections, like chronic fungal infections, chronic viral infections. And yeah, there might be a small group of patients who have a chronic bacterial infection. So we're really only going to be using antibiotics if there's proven infection. Listen, yeah, we got to get real here. I mean, listen, your bladder's screaming. Of course you think it's infection. Frequency, urgency, pressure, pain. Of course you think it's infection. But you have to remember your bladder only knows one language: frequency, urgency, pressure, pain. So guess what? A bullet wound feels like infection. A stab wound feels like infection. Cancer feels like infection. Everything feels like infection, because that's the only way that the bladder can tell you that there's a problem. And I remember my first year, you know what? Like my first year of IC, I swear, I must have had a dozen urinalysis. I mean, like I would call my doctor crying, going, "It's got to be infection." They do the urine culture, come back negative. And again, it's quite common for patients to save their antibiotics. Then you have a flare, you save your antibiotics just in case. So some of you self-medicate with antibiotics when you have a flare, just in case. And ultimately, that's not a wise thing to do, because the more antibiotics you take, the more you run the risk of developing antibiotic-resistant infections and fungi, candida. So as an example, years ago, we had Dr. Paul Fuguzzato, who believed that everybody had chronic UTI. And so we all sent our urine to him. I did. Absolutely. I sent my urine and I did what he recommended, which was 3 to 6 months of Augmentin, and ended up cooking myself up a wicked Candida glabrata infection that I had for 2 years. The antibiotics never helped me. You do have to remember too, though, antibiotics do have a mild anti-inflammatory effect. And so sometimes you might feel better when you take an antibiotic, but it's because it's reducing inflammation. It's not because it's killing something. So in general, IC patients usually do not use long-term antibiotics because rarely do we find infection. Now, that's in stark disagreement with some of our allies over in Europe and in the United Kingdom, and Dr. James Malone Lee, who believe that a lot of patients have chronic UTI. But very few IC doctors support that. And I don't support that. You can't make any broad statements about the IC patient community. There's no one thing. We're all snowflakes. We're all individual. For some of us, it could be traumatic injury. For others, chemical injury. Others, estrogen atrophy. For some of us, fibroid tumors. Tarlov cyst, pelvic congestion syndrome. We just cannot do the all or none statements anymore. Just like when people say, I wish they had a cure, that doesn't work because we can't, you know, you don't cure an injury, you heal an injury. And a lot of the subtypes of IC are based on injury and trauma, not any sort of disease process. Although clearly there might be disease process in Hunner's lesions going on. So anyway. Lydia says, I've had IC for 9 years, been doing well, but I struggle with all right, BV. I've heard taking boric acid is something I should try. Yeah, I mean, boric acid sounds scary, but it's not. I've done boric acid down there. You know, you just have to remember that once you're past a certain age, as I clearly am, the reason why your skin is more vulnerable and you're more prone to UTI is because of estrogen atrophy, also known as the genitourinary syndrome of menopause. You know, as you lose that nice thick coating of mucus, it's easier for irritants in urine to irritate your bladder, and it's also easier for bacteria to infect your bladder. And so it's very common for women of an older age to really be suffering with recurring UTI. And so we want to make sure that's treated. And the way that would be treated is with an estrogen product that would help improve that mucosal barrier, combined potentially with an antibiotic that could kill that pathogenic infection while it's there. Google genitourinary syndrome of menopause or Google estrogen atrophy, and that will give you more info on it. LJ said, just started cyclosporin to help my body calm down. Have you seen success? Yes, absolutely. Cyclosporin is a step 5 treatment option. So we have 6 steps of treatment. You start at step 1, you do everything in step 1 before you go to step 2, everything in step 2 before you go to step 3. So step 5 is the second to the last one. Cyclosporin has been considered a bit of a miracle drug for patients, especially patients who appear to be a bit immune compromised. And just yesterday, I was talking with a dear friend of mine who had, past tense, had extremely severe symptoms. I mean, and she was working as a teacher. She was self-cathing at work. I don't know how she did it. I don't think I could have done what she was doing. And nothing worked for her. And bam, they gave her cyclosporin, and it has healed her massively. She doesn't need to do treatments during the day. She doesn't need to use her pain meds anymore. The challenge, of course, of cyclosporin is that there are two pretty profound side effects. One is anemia, which she now has. So she has to get some anemia infusions or iron infusions. And then it can also raise your blood pressure. And that's something else that she's struggling with. But as she said, thank God, I'm happy to deal with that because I can now function because my bladder is in such a good place, right? So cyclosporin, if you've failed step 1, you failed step 2, you've done all those interventions, step 3, step 4, then cyclosporin is absolutely viable. Your urologist will not give it to you, though. They will refer you to another doctor who specializes in that to work with you on that because it's a fairly tricky medicine. Amber says, what can you expect the first time you go to a pelvic floor physical therapist? Well, the purpose of your first appointment with the PT is just to get them to study your body. We need eyes on your pelvis, eyes on your muscles and bones. And so what they're going to do is they're going to first do an external examination. They're going to have you walk up and down a hallway. Let's see how your muscles are. Let's see if you're walking normally. They're looking for tension patterns. They're going to look for tension patterns in your glutes, in your core, in your back, et cetera, et cetera, et cetera. And then they're going to do a very brief vaginal exam. And the purpose of that examination is to touch your internal muscles that you cannot touch from the outside. And let me get my model here. Oh, you know what? Hold on. This is my aunt. Oh, she hung up. She's probably trying to get a hold of my dad. All right. So let us try this again here. So that internal part of the examination is really, really important, because what she's going to do is she's just going to touch muscle groups. See this? This is exactly what they do. They're just going to reach in. These are your deepest muscle groups, and you've got mid-level muscle groups, and then you've got shallow muscle groups that are right here. And if she can touch a muscle and trigger pain, woo, baby, that's your hallelujah moment. It's like, oh my God, what are you touching? That's it. That's it. And that's when they should identify what they're touching. Is it the piriformis? Here, hold on a sec. Let me see if this is her. Lee, is this you? Okay, everybody's alive. I am doing a live support group meeting, but if you call the home phone, you should be able to reach mom and dad. Okay. Okay, I can't talk to you right now, but here, can you give me your phone number? Mm-hmm. 1936. Is it about one of your sisters? Is it what we expected? Okay. Okay. I'll call you back when we're done. Okay? Okay. Bye-bye. Ugh. Oh boy. I think that means somebody died. But she didn't say that. But I have to call her back. I have to call her back before she talks to my mom and dad. Okay. Well, we might cut this short a little bit. But anyway, let me keep going. She wasn't crying. So that's good. I would assume that if somebody passed away, that she would be crying. Shit. Could you guys just hold on? Would you mind? Could you just hold on for a minute and let me call her back? You guys, give me 2 minutes. Give me 2 minutes. I got to figure this out, because give me 2. Hi, Lee. It's me again. It's Jill. You know what? I want to make sure that this is not urgent and important, so I asked my people to just wait. So is everything okay? Oh, okay. 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 Well, I mean, if that's where oh, no, you can tell them everything. That's fine. That's fine. Yeah. Oh, no, no, I mean, I think he would be absolutely fine with it. So yeah, go for it. Okay, make sure you call on the 3983 number, because that's easier for them to hear. Okay. 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 Thank you. Big giant hug to you, Aunt Lee. Bye bye. Actually, no. Yeah, she's my aunt. She's a distant aunt. Okay, give me 1 sec. I got to go tell them she's going to call. Nobody died. Okay. Hey, Aunt Lee's going to call you in a minute. Lee Maryland. She just called me, and she wanted to talk to me before she talked to you. It is nothing terrible, but I just want to make sure that you answer the phone, okay? Nothing terrible. Nobody's died. Okay. Okay. Sorry about that. Woo! I thought that was going to be one of those calls that somebody had died in the family, but no, it's not that. It's fine. That kind of scared me there for a moment. I hate to be the one to. I mean, if they want to talk to me first, they're worried about how my parents will react. It's like, okay, good. She just called. Okay, let me just take a deep breath. That was kind of freaky. Hold on. Let's just do it. Let's take a nice deep breath here. In and out. In and out. Kind of scared me there. Sorry about that. Okay. So let's get back here to the internal examination. So listen, at that first physical therapy appointment, they're going to touch muscle. And again, if they can touch a muscle and trigger your pain, that is your hallelujah moment. That is extremely exciting. You're immediately going to go, what are you touching? That's it. What are you touching? Now, here's the deal. There are two things that we have to deal with, though. For some people, having somebody down here is not comfortable. It's like, I don't want somebody down there. Especially somebody who has been abused. And that's completely understandable. And so if you are somebody who is extremely reluctant to let anybody work down in the private area, you've got to tell them that. I mean, listen, physical therapists, just like me in my office, we have seen it all. And they want to work with you and ease your concerns and really develop a good friendship with you and trust. And so it's okay for you to say, I can't do an internal exam. I don't want to do an internal exam. And the challenge, and that's okay. And tell them that you have a history of abuse. It's okay. And hopefully over a couple of appointments, as they work with your other muscles, you will come to learn them and trust their insight and knowledge, so that eventually perhaps they could try. And what's funny about, I mean, listen, I've had it done many times now. And I'm going to be the first to say it's odd. The first time you go, that you're laying on your back and you're not in stirrups. It is not uncomfortable at all. And like, I don't know about you, but I laugh. Like that's how I cope with weird things. And so, one of the secrets to success is you being able to communicate clearly with them about, okay, that hurts or that doesn't hurt. Well, I'm a giggler. And so even if it hurts, I'm like going, what? No. I mean, like, I have this really weird giggle response. And so she really had trouble with me at first because she would say, does it hurt? And I would laugh. So they look at your face. They look at your face to try to see if you're grimacing. Because in addition to that grimacing, you're going, like that. If you grimace, then they know they're working in a delicate area. But your ability to communicate what you feel as well as your symptoms is important. I mean, before you go, man, you got to write down your symptoms, especially the weird symptoms. If you have pain shooting down your leg, if you got pain in your lower back, the symptom that happens like once in a blue moon, tell her about it. That's important. You got to let the symptoms go, because the devil is in the details here. And it's often that little obscure symptom that helps confirm a diagnosis. Like if you have pain when you sit down, that goes away when you stand up. Or if you're a gentleman, you have pain that shoots up your penis when you have an orgasm, right? Okay, those are all relevant. And then again, when you're having the exam, it's important for you to try to find a way to say, okay, that's uncomfortable. Be careful. Or like, ow, that hurts, back off. It's okay. You can do that. And they will back off. They are very, very attentive. But the second thing that happens with this patient group is sometimes patients misinterpret that pain. They're like, damn, I'm not going back there. That hurt like hell. Oh, no way. No way. You made me so much worse. Okay. The purpose of the initial exam is to find the anatomy, find where in the anatomy it's hurting. So they have to push. They have to touch stuff. And if they trigger pain, that's really good because it means they found it. And if you're laying on the table and they trigger pain, you should be going, "Oh my God, you just triggered my pain." So don't look at pain as something to be feared. Look at pain as something that is incredibly enlightening in that first appointment. And then at subsequent appointments, they're not going to be as aggressive. They already know the landscape. They already know your body. They already know where they're going to try to work, and they're going to be much more gentle. Right, and so be vocal, talk to them, tell them how you're feeling. I will say with me, true story here, I had pelvic floor spasms for about 10 months after my hysterectomy, and at my first appointment, physical therapy, when she was working with me, didn't hurt. I mean, it really didn't hurt. But as soon as I started walking out to my car, that's when it started to hurt. And as soon as I sat down in my car seat, that's when I started to sob. Like, oh my God. Because again, they were working around my incisions. And so I went back the next week. I went, okay, it definitely hurt when I sat down in the car. And she goes, okay, let's see how we do again. So the second visit, again, didn't feel it during the exam, during the therapy. As soon as I got up to walk out, that's when I started feeling my muscles get tight, the strong pulling sensation. And again, when I sat in my car, that's when I started crying again. Right? It's like, oh my God, this is bad. Right? But again, remember, they were working around my cervical incision. The third appointment is when that didn't happen. In the third appointment, the physical therapy was great. And as soon as I got up to walk out, guess what? No pain. When I sat down in my car, guess what? Didn't hurt. So you got to give it time. You got to give it time. I hope that makes sense, right? I hope that makes sense. Christine says, this popped up on my Facebook. It's really interesting. I used to suffer from IC pain. It evaporated overnight when I dropped sugar, grains, flour, gluten, and all processed foods from my diet. I've had one flare in 1.5 years since I made this change. I was able to resolve it in a day, unlike other flares that would rage on for weeks. I don't know if this is the answer for others, but it has been the best for me. Best wishes. So, Christine, I mean, a couple of different things come to mind. Number one, by eliminating the gluten in the processed foods, you've massively cleaned up your urine. So your urine is not going to be as irritating. And so that's incredibly important. And it also potentially speaks to the fact that maybe you were in the chemical cystitis subtype, or maybe you were in the estrogen atrophy subtype that made your bladder so vulnerable. Maybe, but girl, I salute you. Excellent job. Excellent job. You've eliminated sugar, grains. So, and for me, my sugar intake is tiny now. I try not to eat any regular wheat. I do gluten-free. I feel better when I do gluten-free. I don't get all bloated when I do gluten-free. And it's really rare that I'm going to do any processed foods anymore, with the exception of maybe popcorn or the occasional potato chip. Jessica says she'd love to participate in the so if you want to participate in the IC Awareness Month poster contest, just go on over to the website, and it gives you the few rules that we have. In other words, it should be an 8.5 on an 8.5 by 11 piece of paper. It should say IC Awareness Month on it, and icawareness.org. That's all we ask, and have some fun with it. Dawn says, what can you tell us about modified Thiel's massage? Has that been found to be helpful during spasms, flares? So in our book, IC 101, Gay Sandler, who has early history and all sorts of muscle issues, I'm pretty sure that she talks about that in here. Let me see if I can find it. I'm pretty sure she does. The question is where? You know, I could actually, here, hold on. Rather than me searching through it, let me just pull the file up it and search for Thiel. Hold on. We go here to my cloud drive, and then I'm going to go here to the book category, and then I'm going to go published PDF. Let me open that up. All right, the book is now opening on my computer. And let me just search for the word Thiel. I'm pretty sure. It's searching. No, she does not mention Thiel, but I know she mentions Ricky, but I don't think it's in a good way. Nope. I don't remember exactly where this is. Well, listen, I won't belabor that point here because I know we got people waiting. Okay, let's see. Here we go. So, okay, this is it. The goal of massage is to increase circulation, to reintroduce a feeling of well being, and recreate a sense of relaxation and comfort that may be lost in the pain cycle of ICBPS. Experienced massage therapists will be able to facilitate these improvements by loosening tight muscles, encouraging flexibility and cooperation of body parts. Therapists should take a history of your symptoms, check with you often about the comfort of your position and the amount of pressure and strokes used during the massage session, like too many repetitious movements performed during exercise, too many repetitious strokes to one area of the body during a massage session can cause additional tension. Massage strokes should be firm, but not hard and smooth. The room temperature should be comfortable. A good rule of thumb to follow is that if it feels wrong, then it is wrong. Doctors, physical therapists, chiropractors, and reputable massage schools can usually recommend good licensed massage therapists. Be sure to ask for someone who has experience with chronic pain. Then she goes into body work, myofascial release, Aston patterning, cranial sacral treatment, osteopathic manipulative medicine, chiropractic, homeopathy, acupuncture, Chinese medicine, mind body programs, etc. So I was just reading from the book IC 101. You know, maybe we took out the reference to Thiel. It was like a year ago, so I don't necessarily remember now because hello, I'm 61. The old memory thing. All right, Dawn says, what can you, let's see. Thank you, Nora. Thank you, Shell. Amber changed her Facebook pictures. Awesome. Jessica says, you're very much appreciated. Thank you, hon. Bernadine's asking about artificial sugars. Please, people, really reduce your artificial sugars and absolutely no NutraSweet aspartame. The connection to cancer is now undeniable. Christy says, hi, Jill. Bladder okay. Having installations every week right now. Just having some bowel problems at the moment. I was using primer and cream every day, and doctor cut me back to twice a week. Now having bowel problems. Does that make sense? No, not really. No, I mean, not really. Because unless you're talking about skin sensitivity around your rectum, I have a lot of skin sensitivity there. I mean, I have no shame. I'll tell you just about anything. Um, um, but I wouldn't expect that. You know, bowel issues are common with irritable bowel. You might have constipation or diarrhea or a combination between the two. But I don't know if there's a connection there. Christy says, my back is a mess, curvature of the spine with disc problems and stenosis. I'm going to ask for pelvic floor PT. Good. That's awesome. Carol says, of course, I'm on the toilet right now. I could sit here for hours. I pee in dribs and drabs and never feel like I'm empty. Any suggestions? Yeah, get your pelvic floor checked, hon. You need to get your pelvic floor checked, because if you cannot sit on the toilet and relax and have a full stream, that tells us that it may be that you have extremely tight pelvic floor muscles. And that's how I know if my muscles are getting funky, is because I start to have what you have, drips and dribbles, and I always feel full even when I'm empty. And that's true not only for the bladder, but for the bowel. And so, as soon as that starts happening, I do what I need to do in terms of getting my wand and working with my muscles. Jessica says, my issue is pelvic congestion caused by nutcracker syndrome and May-Thurner syndrome. I don't know what nutcracker syndrome is. I've never heard that. Hi, Trisha. Catherine says, what do you think they would take Elmeron off the market, and what will they offer as a treatment? I would not be able to do or work anything without Elmeron. Well, so Catherine, listen, the flaw with Elmeron from day one that the company acknowledges in their own research is its bioavailability. What does that mean? It's about how much of the drug makes it to the bladder to be useful. And the bioavailability of Elmeron is extremely poor. That more than 92% of it is destroyed by digestion. That means you're lucky to get 3, 4, 5, 6%, or even less of Elmeron actually arriving in your bladder to do something. And that ultimately means that you have to take a lot of Elmeron over a long period of time to get a significant coating of Elmeron in your bladder. And think about how much Elmeron costs. I mean, if you're paying $1,000 to Elmeron and only, 5% of it, 7% of it, actually arrives, think about all that money you're throwing away. A better way to use Elmeron is to use it in a bladder installation where 100% of the medication is delivered directly to the bladder. You're bypassing digestion. You're bypassing the gut. So your first option is to switch to bladder installations with Elmeron or with heparin in the form of a rescue installation that's going to be Elmeron and lidocaine or heparin and lidocaine. Right? That way, 100% of the medication arrives there and very little of it passes into your bloodstream to get to your eyes or anywhere else to cause issues. But fundamentally, Elmeron is quite flawed from a bioavailability standpoint. Your next step after that, since there are no other oral medications that anybody is trying to drive through FDA approval for this, is going to be the supplements that have a similar coating effect. So that's going to be the chondroitin-based supplements, Bladder Builder, Bladder Rest, Cystoprotect, Cystomend are the top chondroitin-based supplements. And they have the same issue with bioavailability, where if you swallow it, how much of it's going to come out the other end. But it's an option, and they do work for quite a few people. Other than that, it's all about using this opportunity to take a step back and revisit your diagnosis. Are we treating the correct dysfunction? For example, if your symptoms started as you got older, then we can pretty much assume that you've got some estrogen atrophy going on. And so the Elmeron is putting a coating in your bladder that would protect those tissues since it's not producing its own coating so well. But if you give that skin estrogen, it will start producing its own mucus and things will start to improve. So for patients with estrogen atrophy or genitourinary syndrome, we don't go to Elmeron right away. The first thing we want to do is try to give that skin something that it can use to produce its own protection, right? Or is there a chance, there are a number of people who've been on Elmeron for years and they've never gotten better. And that's what the American Urology Association says in their guidelines. Is listen, if you're not responding to therapy, if you're getting worse rather than better, for God's sake, stop what you're doing, take a step back and revisit the diagnosis. Have we missed something like pelvic congestion syndrome or pelvic floor dysfunction or a Tarlov cyst or endometriosis. You know, we don't want you to take something that's ineffective. And you really have to, you can't psychologically cling to Elmeron, which some people have done because they say it's the only thing for IC. That's not true anymore. But it's very logical that that happens. And believe me, I've been working with patients every week who are having the same questions that you're having about it. Krishanda, thank you so much for the 50 stars. I really, really appreciate that. So again, let's take a step back, revisit the diagnosis, make sure we haven't missed anything else. If you still want to do Elmeron, ask for an Elmeron installation or a series of those, and let's see if those help you more. If they don't, and or if you just take a real honest look at how you've done in the last 10 years, are you better? Are you worse? If you're worse, then the Elmeron is probably not helping you. Maybe it's time to do something different. Catherine says she's flaring like crazy. So what kind of flare are you having? A bladder wall flare or a pelvic floor flare? Hi, Trisha. Shira says, thanks for all you do. I'm on my second InterStim implant. I'm so grateful for my doctor at Beaumont. I maintained stage 4 for 9 years. Awesome, hun. You happen to have literally probably the best InterStim surgeon in the country, if not in the world, at Beaumont. So you are in excellent hands. Thank you, Nancy. Nancy says, grateful to you. You've helped me advocate for myself. Awesome. Carla says, oh my God, I did so good with my pelvic floor therapy, and now I have COVID, and the coughing kind of causes an accident. It's been a rough month, but I will survive. Girl, you're a tough cookie. You got this. But the coughing definitely tweaks your pelvic floor and weakens your pelvic floor. Hello, Tiffany. She's starting nerve stim therapy. Excellent. What kind are you doing? Are you doing the InterStim or are you doing the urgent PC? Tiffany says, I have IC, overactive bladder, endo, adenomyosis, and pelvic floor dysfunction. My muscles on the left are too tight and they're too loose on the right side. You know, that's actually really common. I'm the same way. I'm exactly the same way. And so what that points to, hun, is that on whatever side they're the tightest, you have to take a step back and look at bones. Do you have a bad SI joint? Do you have, like I have a flexible SI joint on my left side that keeps my muscles fairly tight? Or do you have a tailbone that's healed out of position? Is your left leg higher or longer than your right leg? But that's really important here. I mean, if it were general pelvic floor tension from being in a lot of pain, all the muscles would be tight. So the fact that you have muscles that are tight on one side means we need to take a look at the orthopedics on the left side and see if there's something that explains why those muscles are so tight. Hi, Kim. Hi, Lydia. Rhonda says, I was in an automobile accident with an 18-wheeler. Honey, holy crap. I am so sorry to hear that. You were in a car accident with an 18-wheeler on August 19th. The 18-wheeler was at fault. Now you're in a huge flare. Your kidneys have been hurting. You're also 4 weeks post-op from a hydro. Girl, the common flare tips are not working at this point. I'm at my wit's end. Urologist started rescues in the office today. So did the rescue help? Do you feel better with the rescue? I mean, that's certainly going to numb out the nerves. But the fact that you were in the accident, especially if you were in the front seat of the car, let's say you got rear-ended or you hit head on or they hit you head on, what happens is if your legs are straight out, the force of that accident is deflected up the muscles in your legs and your bones in your legs directly up into your pelvic cavity, where it can damage things. It can damage muscles, it can damage bones, tendons, ligaments. And so it's quite well known for car accidents to cause secondary pelvic floor trauma and pelvic floor tension. I think it'd be really interesting to see what's going on with your muscles right now. Sierra says, if anybody's in from Michigan and looking for additional support or doctor referrals or anything, please don't hesitate to reach her. Awesome. Tiffany, yeah, Tiffany, yeah, I'm seeing your comments, but you have to be the squeaky wheel because they scroll by. Irene on YouTube says, "Oh, and hi Sandy, nice to see you too. Hi Amber, nice to see you." Irene says, "Can bananas be a bladder irritant?" And the answer is not usually. The research studies show that bananas are actually quite soothing to most patients. I personally have never had a flare, but from a banana, but we know that my bladder wall is not the source of my issue. My issue is muscle and nerve driven. And so there are some people who might be more sensitive to higher potassium foods. The research studies pretty much disprove the notion that bananas were bad for everybody, but there are still a few people who might be sensitive to bananas because of their potassium level. Judy says, "What does a pelvic floor spasm feel like?" It can be a pulling sensation or a pushing sensation or a burning sensation. A muscle that's working hard is a muscle that builds up lactic acid, and it causes often a vaginal burning, rectal burning, perineum burning. Um, for me, a pelvic floor spasm ultimately is like there's a hand up my vagina grabbing onto my guts and trying to pull them out my body. It's this very distinctive pulling sensation. Um, a bladder wall flare, bladder wall pain is very sharp and shrill. It's like razor blades in your bladder. And you're extremely diet sensitive. The fuller you get, the worse you feel, and it can be agonizingly painful. Pelvic floor dysfunction does not cause that sharp pain. It's a duller pain, it's an achier pain, it's a burning pain, and you might feel like there's a foreign object stuck in your body that's not coming out, whether it be your bowel or your vagina. Those are classic symptoms of tight muscles. Carol says, "Does anybody else feel overwhelmed when trying to figure out subtype you are? What medications, books, foods?" Girl, yeah, honey, absolutely. Well, this is, listen, if you're feeling in over your head and you're just not understanding it, or you're just not able to apply your situation to that, that's when you can call me, hun, and I'd be happy to try to talk to you. You guys remember that subtyping is so about for the last 10 years, doctors around the world have completely admitted that there's diversity in this patient population. I mean, this is why more than $100 million put into ICU research has failed to find a single therapy, because you cannot put apples, oranges, and bananas in the same research study. You can't put Hunner's lesions, pelvic floor, pudendal neuralgia, and estrogen atrophy in the same research study and expect that study to produce meaningful results. And so there has been a lot of debate, discussion, competition among those top tier researchers to try to understand the variants of IC. So I use a system that Chris Payne created, which is really good, I think, for a clinical setting. But some of those top tier researchers are very, very conservative, and they're really going for what we call evidence-based medicine. They want science to drive their decision making. And so they are now at the point where they admit there's bladder centric and beyond bladder. Also, everybody clearly agrees Hunner's lesions is its own disease called Hunner's lesion disease. So those super formal academics are at the bladder, beyond bladder grouping. Chris Payne was very bold in his proposal, and he took it one step further and came up with the 5 steps. And in Europe they have 12 variations of IC. So, but the odds are your local doctor ain't going to have a freaking clue about this, because the local doctors don't really know about this. Hello, Nick from Australia. Would there be any new medications for sufferers of IC? As I tried Elmeron, which didn't work, and bladder stretchers with DMSO didn't work. And you're using opioids. So, Nick, this is what I say to all the guys I work with. I'm going to say, and now listen, I'm going to be really bold here. And my specialty kind of has always been men, because my first support group was filled with men. Unlike most other support groups in the country, I had a ton of men in my support groups. in my opinion, 90% of the men that I've worked with, if not more, have an underlying pelvic trauma. An underlying pelvic trauma. And last year, for example, we had a research study that showed that 70% of the men who had pain in their testicles had an underlying hip problem. So for men, we're really looking at muscles and bones. We want to know, were you a bike rider? Were you a football player? Did you suffer any pelvic traumas? Were you an athlete? Do you sit for long periods of time? And I would encourage you to go back in time to when your symptoms first began and ask yourself, gosh, was there an event that triggered this? So, as an example, let me give you an example. I had a mother of a 22-year-old man call me, young man, who had such severe pain that he had to drop out of college and he was literally in the bedroom in his mom's house in terrible shape. And she called me because she was looking for hope for him. And so I was like, great, let me talk to him. And I got him on the phone. I went, all right, what do you think triggered this in you? He went, I know exactly what caused it. I can tell you exactly what caused this. I fell off a ski lift, and that night I had this. He fell off a ski lift. Nobody had ever asked him what he thought triggered it. And clearly, in his case, he suffered a substantial pelvic injury that damaged muscles and bones. And we sent him off to pelvic floor examinations and physical therapy. And the last time I heard, he was doing extremely well. Same is true for, I was working with like a 38-year-old Ironman athlete, Hawaii Ironman, just elite athlete. Ironman athletes hit their peak in their late 30s. And he was a trainer. He spent all day in the gym, loved everything. And then one day, bam, out of the blue, frequency urgency. Goes to the doctor. Doctor goes, thinking I've got prostatitis. Gave him prostate meds and antibiotics. Didn't work. This went on for months. And again, his mother called me, and he was a 38-year-old, said, can you help my son? I went, sure, let me try to talk to him. So he gets on the phone. We're going through all of his symptoms. He was not diet sensitive, not particularly diet sensitive. His pain was not sharp. And I was like, all right, what do you do? He goes, well, I'm a trainer. And I'm like, okay, what do you do? He goes, well, I'm an Ironman. And I went, oh, wait a second. So how long do you sit on a bicycle seat every day? He goes, well, I do 100 miles a week. And I was like, okay, do you have pain that changes when you go from sitting to standing? He goes, yeah. I went, do you got pain shooting down your leg? He goes, yeah. I went, you got pelvic floor dysfunction and epidendal neuralgia. He's like, but it's my bladder. It's my bladder. I got to pee all night. And I went, yeah, but you have to understand the relationship with the muscles and bones with your bladder. And he's like, well, I don't believe you. It's like, what do you have to lose? Go get your muscles checked. It's okay. Just go get your muscles checked. Let's see. He goes, I just don't believe you. And he hung up. Well, he called me back a month later. And he's like crying in pain. He's like, Jill, I don't know what to do. It's so bad. Like, I can barely sleep. I don't know what to do. This is awful. I want to compete and I can't. It's like, have you had your muscle checked? He goes, no, I don't believe you. It's like, dude, what do you have to lose? Go get your muscle checked. This went on for months. Finally, it got so bad. He went and had his muscle checked. And he called me from the car. He goes, oh my God, you were right. I have this pelvic injury. Like, it's really bad pelvic injury. You were right all along. And I was like, yeah, well, your symptoms were clearly muscular and nerve driven. And so unfortunately, in his case, he was in pain for at least 6 months until he was willing to have his muscles assessed. So Nick, that would really honestly be one of the very first things that I would do if I were you, is I would want to know what's going on with your muscles. And I would want to know if you suffered any pelvic traumas. There are some exceptions to that rule. If you struggle with multiple pain conditions, if you got super sensitive skin, wicked sense of smell, then we're going to be looking at IC subtype 5 central sensitization. There's also the possibility that if you've used ketamine, or you're drinking a massive amount of energy drinks, et cetera, then you could have some chemical irritation of your bladder wall. I'd love to talk to you at some point in time. If you'd like to talk, we can Zoom and see if we can figure part of it out, and at least give you some questions that you can take back to your doctor. You guys, for everybody watching, you have to understand that It's not my job to give you medical advice. It's my job to educate you and then kick you in the butt and get you back to your doctor to ask new questions, right? And so what I'm trying to do is open new doors for you. But I always want you to double check it with your doctors, which is pretty much what I say every time. Hello, Cindy. Thank you for the 530 stars on Facebook. I so appreciate that. Tiffany said, I always make giant ovarian cysts on the left side. Honey, I did too. I did massive cysts. Debbie says, do what you need for your family. Thank you. Hello, Donna. Rhonda says, I was driving the 18-wheeler, sideswiped the driver's side. The 18 hooked onto my driver's side door. When he jerked back in his lane, it jerked my car over, pushing me in front of the big rig. Holy crap. Pushing your car about 100 yards. Car came on two wheels before it came to a stop. So your car kept repeatedly being hit and jerked. And oh, girl. I mean, you really need to have a proper pelvic floor assessment and a proper pelvic assessment in general to make sure you didn't suffer any problems with your bone, cracked bones, things like that, that you're going to want to be able to cite when you sue that guy or you get your insurance settlement. Tiffany says, when I went for an example. So when you went in for an exam, you overflowed the commode, you overfilled the sample cup, then peed 3 times. That's a lot of urine, girl. Is that normal for you? Sue says, Jill, help. They're now saying my IC flare, rectal pressure, tailbone pain is all from a nerve bundle at the base of my spine. This pain doctor wants to do injections. I've tried all the meds, PT, relaxation. Any opinions? You've had COVID last October. Here, hold on a sec. You know, it's quite possible, hun. It's quite possible that you have, you know, an issue with your spine that's compressing a nerve that could be triggering. I mean, the rectal pressure, the tailbone pain, it's possible. I mean, you know, they can do diagnostic nerve blocks. It would be really interesting to see if a nerve block of the nerve that they think is the problem. If they can silence that nerve with a nerve block and it makes everything go away, then they prove their point. That might be an important diagnostic test to have. What's going on with your muscles? So we clearly have to rule out muscle dysfunction too, right? Are your muscles tight? Tiffany says, do I charge for phone calls? No. You're welcome to call us anytime. If you catch me, power to you. I'm happy to take questions. I do it all day, every day. But if you want to spend an in-depth time going over your case and your history, like 30 minutes or longer, I would want you to sign up potentially for a coaching session. Although many cases people call and we end up talking that long anyway, and I never bring it up, and I would never charge anybody after the fact. You know, sometimes people say they'd like to make a donation because I spent so much time with them, but you know, it is what it is. It is what it is. I'm a softie. If you call crying, believe me, I'm going to try to help. All right. So, guys, remember, IC Awareness Month is today. It starts today. So, what are you going to do about it? Tell me, what are you going to do? Because if not you, who? We are a team. We are a collective team. There is no magical millionaire who's going to educate all the doctors. There is no magical company who's going to step in and sponsor conferences and all that sort of stuff. It's not going to happen. I was thinking about that. You know, in the old days when we didn't know Elmeron was so bad and Elmeron looked very, very promising, there was a company that would sponsor IC Awareness Month, and they would do events and they would do all sorts of stuff. We don't have that anymore. And so IC Awareness Month is a grassroots effort. This means that you need to think about something that you would like to do. And again, over on our website, icawareness.org, at a minimum, if you could just print out our press release or copy and paste it and send it to your local paper, we have to, what I always try to do with our press releases is do a story that could reach somebody who's suffering and give them hope. And this year, IC in general is not going to get a lot of coverage because COVID is so big. So what we're doing is we're talking about COVID associated cystitis, which means we might have a chance to actually get a paper to do an article on this. And it's going to be really interesting. So again, a school district announced that they were only going to give four bathroom passes a year to students. But imagine if that student had COVID, and imagine if they have long haul COVID that's affecting their bladder. They're going to have to pee every 30 minutes. And some of these schools are punishing students. You have to go into detention if you need to use the restroom. And I'm sorry, that's not okay. You cannot punish somebody at school or at work or at home for needing to use the restroom. The bladder, like any other part of the body, can be damaged. There was a good lawsuit, I think in Chula Vista, California, of a mother whose child started having accidents at home, and also there were some other issues too. And what the mother eventually figured out is that the teacher would not let the children go to the bathroom, and she yelled at them. And so her son was terrified to go to the bathroom. So what happened is he was holding it all day. And he ended up with some really bad bowel bladder problems because of it. And she successfully sued the school district because children need to use the restroom. To ask a child to hold it at the time when their brain is learning to process these sensations is completely counterproductive. And so these are the types of stories that get media attention. And we have to fight for each other. We do. So Tiffany said, how does my body make so much pee? Well, there are some medical conditions that can cause you to make a lot of urine. And it could be, so I think patients with diabetes end up producing a lot more urine. There are some medications that can cause you to release more urine. I think one of the things that's so interesting, Tiffany, though, and I'm sure you guys can relate to this, is that let's say you've got to go shopping, right? You got to go to the grocery store or whatever. So, of course, right before you leave, you go pee. But let's say you've got to drive 15 minutes away. And so on the drive, you're going, uh-oh, I need to pee. And when you get there, it's like, I really need to pee. And you go use the restroom, and there's like a lot of urine there. Like you're peeing for like 20 seconds. And you're like going, what the hell? I emptied my bladder 15 minutes ago. How is that possible? And the stress response can trigger salivation, lacrimation, urination, and defecation. That's something I learned in pharmacology school, that there are some moments when under stress where your body is diverting things and changing things because it's trying to prepare you to fight or flee or something else like that. So sometimes you can produce more urine that way. Or it might be natural. It's hard to say. I mean, it's certainly something you've got to say. You've got to ask your doctor, and you've got to give them context. You've really got to give them context and tell them the volume. It would be really good to do avoiding diary and try to give, a volume of how much you're peeing a day. And, and it could be something as simple as just drinking way too much water. There's a lot of debate now about, is 8 glasses normal? And the answer is they're saying no. That's probably too much for some people. Maybe 6 glasses of water a day. Maria says, my ovulation flares are brutal. Specialist wants to try the birth control pill in hopes that it helps. Have you heard of that helping cut down on ovulation flares? Well, Maria, the thing about ovulation flares is that they they're very short term. Like when I flared when I was ovulating, it would be like a 12-hour flare or a 24-hour flare, and then it was done. So are you saying that your flares are lasting longer than that? I mean, if they are, and or if you have polycystic ovarian syndrome and you're starting to produce a lot of ovarian cysts, then the birth control pill would be an interesting experiment. Tiffany says, I went into chemical menopause and it did not help. It caused more issues, bones and joints. Jessica says, happy September and IC awareness, my friend. Thank you for all of your advice and love. Right back at you, Jessica. We are in this together, my friends. We are in this together. All right. Well, listen, it's 4:30 here in California. I still have some work to do. So I'm going to do a last call for questions. Otherwise, you will find me, knock on wood, fires, and the health of family members. I will be back here on Sunday to do another support group meeting. So last call for questions. Any last questions? Hit me, baby. Hit me. Give me a toughie. And if not, that's okay. Tiffany says, have you done any research on ashwagandha? I have not done research on ashwagandha, but you know who did is here. Where is it? The first book that on IC that really did a deep dive into a natural alternative approach is a book called I See Naturally by Diana Brady. I See Naturally by Diana Brady. And ashwagandha, I'm pretty sure has a nice anti-inflammatory effect. Let me see if I can find it here. So it's something that we have sold in the IC Network store. It's not a big seller because a lot of people don't know what it is, but let me see if I can find it real quickly. Oh, I need to just reread this book. I mean, and you have to reread all these books. They're just really good. Where is it? And unfortunately, Diana lost her battle with cancer several years ago. So her husband is continuing to sell the book. Well, anyway, I can't find it, but what I can tell you is ashwagandha is a supplement that has been found to, again, if I remember correctly, reduce inflammation. And it's certainly something that we're receptive to. I haven't had any bad reports on it. The challenge is people just don't know about it. Nick says, thank you for your educational advice. You are an absolute... Nick, thank you for the 99 stars. I really appreciate it. You are very, 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 very welcome. So Nick, since you're still there, do you want to try to talk a little bit about what's going on? Or you want to do it offline? I'd be happy to talk with you further. Your choice. What would be a good meal for the first day of IC Awareness Month? You know what would be good? Would be gluten-free raviolis with Parmesan cheese, topped with stir-fried or sautéed mushrooms in butter with some fresh seasonal zucchini on the side or corn on the side. That sounds really good. Those are kind of like the meals that I tend to have. Okay, so Tiffany says ashwagandha lowers cortisol levels. Okay, thank you. I didn't remember off the top of my head. All I know is that it's got a good vibe. Sandy, thank you. You're very, very welcome. What's your favorite breakfast? So a perfect breakfast for tomorrow for the second day of IC Awareness Month would be, if you can tolerate oatmeal, go ahead, go for the oatmeal, which is high in fiber. You know, we have a great website, icdietproject.com, the icdietproject.com. There's a lot of recipes over there. Everything's free. Really good breakfast recipes in there. There's a great blueberry streusel breakfast cake in there is to die for, a lot, and also some oatmeal, yogurt, granola breakfast things that are very, very icy friendly. You'll also find a lot of good seasonal recipes too. It's really good. All right, my friends. Well, I tell you what, if you need to get a hold of me, you can go to our website. Our 1-800 phone number is right at the top of the page on our website, icnetwork.org or icawareness.org. And if you want to reach out to me by email, my email address is icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. icnetwork@mac.com. Makes me wonder, Tiffany, if it would be helpful for COVID-associated cystitis. That's gonna be it. That's gonna be something we're all gonna be working on for some time, especially with long-haul COVID patients. So, all right, my friends, big giant hug from California. No fires right now where I am. South Lake Tahoe is burning, though, like mad. So, all prayers welcome for California, all right? I will see you later. Peace out. These are little hearts. These are little finger hearts. All right. See you later. All right. That's it for YouTube.